As of November 6th, the way the COVID numbers are reported in Massachusetts has changed. Sigal Reese stopped by the studio to explain the new metrics.
Public health doesn't work without public engagement. No one in town hall or the governor's office, or really any governmental office, can stop the spread of COVID-19. But together, with the sum of all our actions and behaviors, we can stop the spread. We all need to do our part and follow the safety standards, the governor's orders, and the advisories to stop the spread. We know what works. We know wearing a face covering reduces the chance of spread. We know staying 6 feet apart from others reduces the spread. We know washing your hands and using hand sanitizer reduces the spread. And we know gathering increases the chance for spread. We also know how contact tracing works. We need residents to abide by our request to isolate and quarantine. We need everyone to follow the public health guidelines in order to slow and stop the spread of COVID-19. The state has revised its metrics to classify communities as gray, green, yellow, or red. It is valuable to look at multiple data points to describe the situation on the ground. In addition to the average daily case count per 100,000, the metrics now take into account the percent positive. This takes all the tests taken over the last 2 weeks and divides the number of positive tests by the total tests. An increase in the percent positive means testing is not keeping up with the increase in cases. If we see more cases, we need more testing so we can identify the cases, ask them to isolate, and quarantine their close contacts. Norwood, like the state and the country, is seeing a rise in case numbers. Across the state, we are also seeing an increase in hospitalizations. While the case count is rising, we continue to have a good low percent positive. This week's Norwood percent positive is just under 3%. With the opening of Norwood Hospital testing trailer, there is now more access to testing. We are also not seeing transmission in our schools. With the hybrid model, most of the students are in the building only 2 days a week. So if they are positive, it is less likely that they will be in the building when they are contagious. Also, the schools are doing a great job with the safety requirements, social distancing and mask wearing. The school-age cases we have seen are mostly from exposures at home as part of a household cluster. We need to all follow the public health advice so that we can save lives, keep schools open, and keep businesses open.